Thank you. Welcome to the St. Clair County EMA briefing here on a Sunday afternoon where I'm joined with Chairman Mark Kern and Barb Hope from the Health Department. And Barb, as always, it's a Sunday or question and answer day, but first we've got some numbers.
We sure do. Welcome everyone on this beautiful and quite warm Sunday afternoon on August 23rd. As far as St. Clair County, today we have a total of 782 that have tested, reported today, with 74 of those positive. Of those, we had both males and females from under 10 years of age all the way up to 80 years of age, making our today's positivity count at 9.5%. Therefore, totals for St. Clair County, we have tested 56,762 folks. Positive were 5,370. And then negative would be 51,392. Unfortunately, we do have a death to report. It was a female in her 70s, and she did not have underlying health conditions, but died with COVID-related illness. Our sympathy goes out to her family, and that makes a total of 173 deaths in St. Clair County. So far, we have 4,492 folks who have successfully completed the IDPH required 10-day isolation period. So the rest of the folks that are still recuperating, our prayers for a quick recovery. Statewide, we have tested 3,704,035, an increase of 1,893 positive cases for a total of 220,178, and unfortunately an increase of 6 deaths in the state of Illinois for a total of 7,880 deaths. Hospitalization rates currently in St. Clair County, we have 47 patients, COVID-related patients in our hospitals, and 2 of those patients on ventilators. Again, we hope and pray, our thoughts and prayers go out to them for a speedy recovery. As far as congregate living centers, the one death that was reported in Caseyville Nursing and Rehab for a total of 28 cases and then 1 death. Testing-wise, we have several testing sites coming up this week. Both Monday and Tuesday will be at SWIC, the Southwest Illinois Junior College. Enter off Carlisle Avenue or 161 and immediately turn right. We have both a drive-up and a walk-through clinic available. The walk-through is kind of based between the Metrolink and the college doors, where the drive-up is on the other end of campus on the outer road to help relieve traffic. So those are both from 8 to 4, Monday and Tuesday. Also, Tuesday, we will be set up in New Athens. This is a walk-up in New Athens from 10 to 12 and from 1 to 3. On Wednesday, we are set up in Dupo from 10 to 12 and tentatively scheduled for 1 to 3. That may change, but right now for sure in Dupo from 10 to 12 on Wednesday. And then next weekend, both Saturday and Sunday, we'll be at St. Clair Mall from 8 to 4. This will be a drive-through, and it'll be located in the back close to underneath the water towers in that area. That is 8 to 4, Saturday and Sunday, August 29th and 30th at St. Clair Mall. So with that, I will turn it over to the chairman. How are you today?
I'm great, Barb. How are you today?
Good.
So I just want to say, you tested 6,336 people this past week. Mm-hmm. I remember when we were testing 3,000 and we set that goal for 6,000. You've really done a great job making sure these tests are getting out. Of those 6,336, we had 509 new positives. Mm-hmm. So that's 509 people that we've been able to get out, isolate, get out of the general population, the general circulation, and get that virus quarantined. So I want to congratulate you. That's a big deal.
That is.
6,336 tests in St. Clair County. That's got to be a record week for us.
It was. It definitely was, and I feel that this week too, with 4 huge sites and 2 smaller sites this week, that we should be close to that as well. And not only those 550 positives, those are the positive cases. We also pulled out folks that were quarantined that may have been exposed as well. So even those numbers were larger to try to help control the virus by isolating and quarantining close contacts.
And the good news is the hospitalizations were up 1. I mean, that isn't any hospitalizations are not good news, but
Right.
only going up 1 is a good thing. And then I think we did have 2 more on ventilators than we did a week ago. So so you're really got a hold of this thing, and now we just need to make sure it heads that direction.
We are. We're working very hard to try to get that and getting, community support and trying to get folks to wear their masks. I think I feel just in the general public, we've seen that a little bit better, and we need to continue to do that.
Thank you, Barb.
Thank
I
you, sir.
appreciate your good work, and we'll be back with you with questions. You got the lion's share of questions today. We'll move into the zip code report at this time. In 62059, we remain again at 10. 62201, we went up 3 today to 214. 62203, we went up 1 to 173. 62204 stays the same at 125. 62205 goes up 1 to 175. 62206 goes up 2 to 387. And 62207 goes up 2 to 222. 62208 goes up 3 to 334. 62220 goes up 2 today to 423. 62221 went up 6 to 501. They now are over the 500 number in 62221. 62223 goes up 2 to 301. 62225 remains the same at 22. 62226 goes up 9 to 567. 62232 goes up 3 to 134. 62239 goes up 3 to 71. 62240 goes up 1 to 24. 62243 goes up 2 to 48. 62254 goes up 8 to 176. 62255 stays the same at 14. 62257 goes up 2 to 27. 62258 goes up 7 to 118. 62260 remains the same at 89. 62264 remains the same at 77. 62269 goes up 6 to 407, and 62285 goes up 1 to 54. Herb?
Very good question and answers day. Before we turn it over to Brian with the ones that come in, there's a question, more or less the statement, that says, I'm wondering if you've been notified about restaurants not taking reservations. I thought I read that required. And I've had my friends and my parents tell me that they've been to several restaurants that aren't requiring that. Barb, with restaurants sent there, they've all got knowledge of that requirement.
They are asked to make reservations. Obviously, if you walk up and there's empty tables, you can see their outside seating. If they're open, doesn't mean you can't seat them. When they get there, then they need to track who's there and at what time.
They need to keep a log then.
Right, they need to track that, absolutely.
And last night, sheriff's deputies have been out this weekend, and they actually issued citations when they found establishments without those logs. So they are required.
Right. Instead, this person sent in about 6 different locations, and I'll forward that on to you just so you can check them out.
We'll remind folks to make sure.
And that's it. Just compliance is what we're looking for. So
Absolutely.
turn it over to Brian. He has the questions that come in today.
Okay. We'll start with Barb with some health department questions that came in. First person asks if 2 people who live alone in their own homes but are together frequently, an example would be brothers and sisters, but they both test positive, should they isolate together in one home or alone in their respective homes?
We recommend alone in their respective homes for several reasons. One, one person may have more symptoms and be more ill than the other. We don't know when they were tested, what their time frame is for isolation. So we highly recommend them to remain separate, to isolate.
Okay. The next one came in, says if a company has a person that is positive for the virus and was at work for 4 or 5 days before he got his test results back. Unfortunately, the company has not told the other employees that were around him. They apparently are not letting their employees know about it. They have told people if they think they have it and want to stay home until they know for sure, they can do so and use their own time. But if they find out they're positive, then they can work to get COVID pay. In the meantime, this person goes to work and could be passing on the virus. They're saying this is because of HIPAA laws. The employee told them they were around a relative that had the virus. To me, this could be a reason the virus is spreading so much in our county.
Well, that is true, but one of the things we ask that anybody, if you go get tested, and especially if you have symptoms, please don't go to work. Please don't go out. Please, stay home because you're sick. Even if you're asymptomatic and you go get tested, waiting for those results, we recommend if you feel you may have been exposed, do not go to work. Each business has their own policy, obviously, and if you become COVID positive, then it sounds like in this scenario that the business would pay the individual. Otherwise, you have to use your own time. But we, again, highly recommend that when you're tested or if you're symptomatic and waiting for test results, that you do stay home and stay isolated, stay away from folks.
Okay. The next person writes, do the schools have to follow the 25-person limit in their cafeterias and gymnasiums?
They do not. The 25-person limit is for social gatherings. Social gatherings like weddings and parties and private gatherings. That's what it's intended for. Schools are still at the 50-student limit.
Okay, so no change in the school guidance
No
at
change.
this time.
No.
Next person wrote, my coworker's wife tested on Sunday. She got called by the health department on Wednesday with a negative, but received another call on Thursday indicating positive. How could this happen? And then how would we believe the result?
Okay. I'm not sure on this situation. If you would, please call us so we can figure out what happened here and whether or not an individual might have tested twice. They could have tested on one day and then went again and tested 2 or 3 days later. And you can get different tests from Sunday to Wednesday. That's why we say you can't test out of quarantine, because it's possible that test is only good for that point in time when you're being tested. So you could pick it up 2 days later. But if you have a question about that, please give us a call and we can straighten out whatever may have happened here. We get a lot of tests. I know we're very, very busy, but we want to make sure we get the right information to the individuals.
Okay, one more for now. Person wrote, why are we seeing people state that they are not getting tested but receiving results in the mail?
And I've heard a few things about this or Facebook comments. Please let us know about those cases if that happens and where this is happening so we can find out what's going on to make sure whatever the glitch is, whatever facility you're going to test at, please let us know and we'll try to follow up and get that straightened out for you.
Well, and I want to comment on it because there was a question that came in early this morning on the page, and I'm not so sure some of those questions aren't from some what they call the trolls, because I asked the individual to please private messages or even call the office and provide us a little bit more information, like where were they tested at?
Right.
Because her complaint was that they were in line at a testing site, filled out the paperwork, and left, and never did get tested, but then they got a positive test in the mail. To me, that sounds a little strange.
That's the
And
same
then
one
plus-
that we were following up. We received that one as
and
well.
plus, they haven't
never
called us
heard
with that
from anyone.
information, so I'm glad to hear what you said. They can call the office and then get the information and then find out if this is legit or not. Because there are
Absolutely.
people out there, as we know, that are trying to sway the other way.
But on the other hand, the doctors are straight out saying that these tests, and really no tests, are 100%
Correct.
accurate. And so there can be an occasion where someone will test negative and later test positive with another test. What they do say is that if you are diagnosed positive, very few of those tests are wrong. If you're positive,
Right.
you're positive. It's the negatives that there is a certain amount of those tests that may not be accurate. So what that means is if you have symptoms, stay home. Even if you
Absolutely.
have a test that says, oh, I'm negative, And if you have a fever or if you're displaying any of the symptoms of COVID, just stay home, quarantine till you feel better. You may want to get tested again just to make sure that you don't have it. But if you got those symptoms, whether you have COVID or not, you really don't want to pass anything along. We're moving into flu season. It's important that we really keep the community as healthy as we can.
Absolutely, and you're absolutely correct. There's more chance for a false negative than a false positive test result. So, again, as you said, if you don't feel good, stay home. Don't spread it to the rest of the community, the rest of your family.
Chairman, a few that came in for you specifically revolving around the mitigations and stuff that were just recently imposed. The first person asked, what phase or tier are we in right now?
So we remain in phase 4, which we've been in since the end of July, but we have moved into what is called tier 1, and tier 1 is the mitigation that allows us to stay in 4, but it kind of pulled back on a few of the things that we were doing at the end of July that now we no longer are able to do. So phase 4, tier 1 mitigation.
Okay. The next person says, our regional positivity rate has been off the charts this past week. Can you provide a timeline for moving to tier 2 with additional mitigations?
So our regional positivity today is 9.6%. That is above the 8% level that the state set for us, and that was the reason we went into this mitigation phase. So what IDPH has said, they're going to track us for 14 days. So that's basically September 1st, we're going to be looked at. And if the average positivity is below 6.5%, we get to move back to where we were in phase 4. If it remains between 6.5% and 8%, then we stay the same. We stay in the mitigation factor that we are now. If our average positivity rate goes above that 8%, then we very well might move into tier 2, which then includes more restrictions. So we are keeping an eye on our positivity. Our daily positivity in St. Clair County, the rate as we track it today is 9.5%. As I said, the state looks at our rate a little, their timeline is a little different. So they peg us at 8.1% today, less than what we peg ourselves. Bond County today is at 2.7%. Clinton County is at 7.5%. Madison County, 8.9%. Monroe County, once again, 10.3% today. They lead the number of COVID positives. Randolph County is 9.6%. St. Clair, they have us at 8.1% today, and Washington County is at 4.4%. So 9.6% positivity. Those tier 2 mitigations might be coming if we don't get this under control. That's why Sheriff's Department was out this weekend looking for compliance. It's those places that aren't complying that are going to cause everybody to have to go back into the tier 2 mitigations. And that's where we don't want to be. So this really, this lies with all of us. Let's do as we're instructed to do by the medical professionals, and we can keep this rate low and we can get back to where we want. But if we don't, I'm afraid tier 2 mitigations might be on the way.
Chairman, that leads right to the next question. If our region's positivity rate continues to be high, what could the next set of restrictions be?
Well, I think that it has been stated that closed indoor bar and restaurant services will be part of that. Elective surgeries will be suspended at the hospitals and the medical facilities, which will greatly hurt the medical community. That's a big part of the income levels of our hospitals are elective surgeries, so that is a problem. They'll add limits on gatherings and room capacities. Indoor recreation activities will be suspended. And retail that's non-essential, we very well might go back to that point again. To curbside and delivery for non-essential retail. And then, of course, hair salons, barbershops, they might close those temporarily too. We don't want to go back to tier 2. And the state has said that they will add mitigating factors if we are at that level of above 8%, that positivity for 14 days. So we're hoping that it doesn't add all of those things in for tier 2 if that's where we are. Basically, though, we gotta get this virus under control, and so controlling a few of those things is going to make a big difference.
Thank you, sir. Barb, a few more questions that came in for the health department. The next person wrote, the other day 9 additional deaths were announced and said they occurred over a 4 to 6 week period. Are we able to provide the age and date of those deaths of those individuals?
Again, I don't have the dates with me, but I do have where these occurred once we resolved this discrepancy. In the general public, we had a female in her 60s with unknown underlying health conditions. I don't have the dates, but it was with the past 4 to 6 weeks. We had a male in his 60s with unknown health conditions and a male in his 70s with unknown health conditions. Also in that group of 9, we had 2 deaths at New Athens Home for the Aged, a male in his 70s with underlying health conditions and a female in her 90s with underlying health conditions. We had 1 additional case at the Lebanon Care Center. It was a 70-year-old male with unknown underlying health conditions. We had 2 cases at Cedar Ridge, a female in her 90s with underlying health conditions and a female in her 70s with underlying health conditions. And finally, we had 1 death. One of those 9 deaths was at Brea in Belleville. It was a female in her hundreds, and she also had underlying health conditions.
Okay, thank you. Next person wrote, since so many people are testing positive, why are we seeing fewer get hospitalized?
Again, I'm glad fewer are being hospitalized, absolutely. I think a lot of the folks that are testing positive are asymptomatic. They don't feel sick, they're not showing any symptoms, but they are carriers of the virus. So it's good to know that people are getting tested, and with them not knowing that they're sick, to make sure that they stay out of the general population. As Chairman Kern said earlier, we need to isolate these folks and also the quarantine their contacts to get this virus under control in our community. So fortunately, not as many hospitalizations with those that are testing positive, because I think we're finding more people are asymptomatic, and when we call them, when we do our contact tracing, they're rather shocked to hear that they're positive.
Okay. And we are seeing, as we talk about each day, a younger and younger group, which were generally considered to be healthier, and maybe you're battling this a little better than when it first started attacking our long-term care facilities and those more vulnerable populations in the beginning.
Absolutely. Just like our age breakdown today, we had 73 cases, and 40 of those were age 40 or less. So, again, quote, the healthier population, so they may not even realize they're sick or have mild symptoms, but are still positive for COVID and can transmit that to the public, general public.
The next one, we've had a couple questions along this topic, and the person wrote, using the data given daily, our weekly positivity rate would be considered to be around 6.9%. The state has us listed at 9.2%. Why is there such a huge discrepancy? Which one would be correct, and what can be done to correct these?
Okay. One of the things, again, part of it is when we do the cutoff point for our daily reporting. How we do our statistics for St. Clair County is we take our actual lab reports we have received through our state database for that day. It's called INEDS, Illinois National Electronic Disease Surveillance System. So those are absolute cases that we have a lab report stating an individual is positive or an individual is negative. So those are our absolutes. Yes, we compare them to the state, and the state numbers are different, and every day we try to strive, just like with the death rates last week, we're like, why are these different, and compare all the statistics, all the information the state has to make sure we correlate. So for instance, for today, our totals of how many tests we've done for St. Clair County so far are 56,762. On the state's website today, they show us as doing 56,483 tests. So there's that we show 279 more tests. On the positivity side, St. Clair County shows 5,370 positive cases. The state's only showing 4,882, difference of 488. And again, we're following up with this to make sure and going line by line, name by name, to see where these discrepancies are. And if you look at those percentage-wise, state-wise, overall, the state's saying our percentage rate is 8.6% positivity. When we look at our St. Clair County numbers, overall, it's showing 9.46% positivity. So again, there's a lot of numbers, a lot of labs, a lot of information that's being collected, but we're really striving to make sure the information is correct, and we use actual lab data for our reports on a daily basis.
Well, Barb, and I think it's worth noting that our followers here are looking at St. Clair County. There's 102 counties in the state of Illinois that's doing the same thing of crunching the numbers, doing testing. So it's just not here. It's across the state. So there are going to be a few of those discrepancies that have to be cleared up. It's just not like we're the only ones that's putting numbers into that system. So they're coming from all over the state.
Absolutely. And again, I rely on our reports because they are lab-based. They're actual laboratory reports that we get, and that's the most reliable information we can use.
And it's all about timing. So the fact that we're really acting in real time. You're talking, you gather your numbers as of 2 o'clock that day, every day, and that's why our number, we believe, is the most accurate picture, snapshot of how St. Clair County is at 2 o'clock on each day. That then allows us to look at our mitigation factors and know that we got to step up our work, or things are looking better. It's a timing issue. I don't think the state really likely has any cases that we don't have. At the end of the day, we're all going to end up in the same place. It's just they're working on a 10-day window, and we're working on a 2 o'clock in the afternoon every day window.
Absolutely, and that's when we follow up with the cases and those contacts. As soon as we get them, we have contact tracers that are working every day.
Okay. The next person, kind of a confusing question here, so I'll try and get through it. It says, I called the health department and first got put on hold for 30 minutes, then told someone would call me back about my test result. I never got tested, but I went to the mobile site in Fairview Heights. So I'm not sure what there's...
I'm not sure either, and I guess and I apologize if you're put on hold, but trust me, our phones are very, very, very busy with all our contact tracing and the questions that we're getting from the general public and the schools. But if you would call us and give us a name, I don't understand if you got tested or you were trying to go to a mobile site in Fairview, we can look up your test results for you if you were tested. So please call the health department, we can straighten that out for you.
Thank you. And one final question that came in says, will you be able to report cases on university campuses, such as ones with dorms or on-campus housing? Could this be considered a congregate facility?
Yes, it can. In schools, some of the universities have just started and opened, so as we get those numbers, we'll be reporting those in the future. Yeah.
Okay. Thank you very much.
Very good. That's our question and answer session for today. We appreciate everybody who submitted those questions, and hopefully we were able to answer you. And there were some that came in on the feed today, and we'll try to get the answers to them later on this evening or tomorrow. But we appreciate everybody trying to do your best. Team St. Clair, as always, we thank each and every one of you. For those of you who are not quite made up your mind, 173 deaths there in our county. We keep saying every day that's one is too many, and so as Chairman Kern said, we've got to all pull together. This is not a one-man show. It's every citizen in St. Clair County has to do their part if we want to get this thing behind us. So we'll be back momentarily with Cindy to translate this into our Spanish-speaking community, and then we'll be back tomorrow with our next briefing. Thank you.